My name is Amber Snodgrass, and I am a multimodality tech at Banner Health. What that means is that I am a rad tech and a CT tech, and that means I do x-ray and CAT scan. I love working in healthcare. I love the patient care. I love seeing all of the people every day, being able to help others, work together with a great team to take care of people and make a difference in their lives. What we do as radiologic technologists is varied. We can work in any variety of places, starting from an outpatient clinic to hospitals to urgent cares and surgery centers. A career skill that I use every day in my position is critical thinking. There are many different types of equipment that you can use. You might be in the ER using a regular x-ray machine that you have to use to go into different positions, and the patient's bones might be broken and you can't move the patient, so then you have to move your machine and get the positions that you need. An academic skill that I use at my job every day is math. I know nobody wants to hear that, but math is essential. You have to use geometry skills to find the right angles. We have to use algebra skills to make sure that we use the right techniques, which is basically the radiation that we're throwing at someone. We have to make sure that it's the right amount so that we don't give them too much or too little. An academic skill that I use every day at work is science. I use anatomy and physiology when I'm working on positioning of a patient, when I'm doing any kind of x-ray, when I do fluoroscopy and I need to look at the anatomy of their stomach and know which way the patient has to be tilted to see a certain part of that anatomy. If you would like to be a rad tech in a hospital, then your first step is going to be finding a college with a radiology program and attending that program. It is an associate's degree and they last about 2 years. You would be doing a mix of classwork and clinicals. And clinicals is basically where you go to a different facility and you have on-the-job training. What I did is I cross-trained into CT or CAT scan, and then I decided that I wanted to stay in x-ray as well. So I do x-ray and CAT scan, and that is why I'm a multimodality tech. So when I was in high school, I didn't know what I wanted to do. I did know that I wanted to be in healthcare, and that was the route I wanted to take. So I started talking to professionals that I knew could give me advice on what different availability there was in the hospital setting, and that's how I found x-ray. And x-ray is the best, but you can go to hospitals and you can observe different areas and you can find out what best fits you and what you think you might really like to do.